Person-centered care is important. Equally as important are the quality indicators. Hi, I'm Dr. Jim Collins. My topic for you today is important person-centered care quality indicators. Okay, by now everybody's heard of person-centered care. Some people really do it well. Some people are just starting. Some people have heard about it, but they're not really, doing a great job with it. So, in the very least, delivering care that respects and responds to an individual's preferences, their needs, and their values form the building blocks, the cornerstone of person-centered care. Healthcare professionals are encouraged to form healthy relationships with not only the people they care for, but with their families and their friends and others who could provide very valuable information about the personalization of care to be provided. These people are great sources of data. They can share. This is what my mom usually likes. She likes to get up at this hour. She likes a cup of coffee in the morning, put on the news, and then she won't get so stressed out in the morning. Ultimately, this level of care should lead to what? Positive health and quality of life outcomes. What are quality indicators? So, quality indicators are just metrics. They're ways of measuring things. Lots of industries use metrics or measurements to guarantee certain outcomes. For instance, pizza commercials. If it's not delivered to your house within 30 minutes, hot and fresh, we pay for it. That is a quality indicator of the time it takes the pizza to get to your house. So it's a quality indicator. Translated, though, into person-centered care in nursing homes and assisted living communities, quality indicators are critically needed tools used to measure performance and quality. They also help to demonstrate the extent to which improvements that they've already instituted have led to positive outcomes. Why do we need person-centered quality indicators? Because you can't improve what you cannot measure. That's the most simple way of putting it. Here are some important indicators, and you may think of some that I haven't jotted down here, but staff. Let's talk about staff for a minute. They speak in terms of person-centered principles. What would our resident like? What do they prefer? What's most important to them? So they speak and they act according to person-centered values. They talk the talk, they walk the walk, they do the whole thing, right? Staff have been well trained in person-centered care, and they can apply it practically and daily in nursing, social services, activities, dining services, and so on. Residents don't just have a choice, but they have meaningful choices that mean something to them. Okay? Residents and families report high satisfaction with quality of care and quality of life. The overall culture is a quality indicator. Is it person-centered, or is it still hospital-like, institutionalized, over-medicalized? No fun. Residents have a choice and a voice concerning their care, where it happens, how it happens, and they have a voice concerning their life. It's their life to live. Staff deliver care and services with respect, with compassion, and dignity. Short and sweet today, but I just wanted to stress person-centered care. I hope more and more skilled buildings in particular are implementing a person-centered philosophy. I wrote a great book on this several years ago. I said great. I wrote a book on this several years ago called The Person-Centered Way, Revolutionizing Quality of Life in Long-Term Care. And you can find it on Amazon.com. I've been on fire about person-centered care as a gerontologist, consulting, training, educating in literally hundreds and hundreds and hundreds of buildings, skilled and assisted, across the country. And I'm going to continue doing that as long as I can. But I also like to put out videos like this and write articles just to give people little snippets, little bits of information here and there, but to also encourage them, keep it going. Person-centered care is never done. And again, if you have it, you have to measure it because you can't change and improve what you can't measure. I'm Dr. Jim. Keep coming back for more information. Well, I certainly hope you enjoyed the video, and thank you very much for your time. If you'd like more information about a great online learning management system with the most wonderful support, best in class support, and partnering, please look for the link to the website in the description. You'll love what you see.